Kidney damage is often referred to as a silent killer due to its subtle progression. Did you know that over 1 in 7 adults in the United States live with chronic kidney disease, CKD? Alarmingly, nearly 90% of these individuals are completely unaware of their condition. It's not uncommon for kidneys to gradually lose their ability to function over a period of 10 to 20 years before advancing to end-stage kidney disease, ESKD, at which point they operate at only 10 to 15% capacity. Detecting kidney disease early is crucial for effective intervention. Unfortunately, CKD is usually symptomless in its initial stages, and diagnosis often relies on laboratory tests. But while medical tests are essential, there are subtle signs you can notice at home that may indicate kidney damage. Let's dive into 5 key warning signs you shouldn't ignore. 5. Persistently foamy urine. Ever notice layers of bubbles in your urine that don't dissipate quickly? This phenomenon, referred to as foamy urine, is often a result of proteinuria, a condition where proteins such as albumin leak into the urine. Normally, proteins are retained in the bloodstream, but kidney damage can cause them to spill into the urine. Albuminuria is among the earliest detectable signs of CKD and can even occur in stage 1 of the disease. However, it's important to note that not all cases of foamy urine indicate a serious issue. Only about a third of individuals reporting this symptom are found to have significant proteinuria. Still, if this persists, it's worth consulting a healthcare provider for further evaluation. 4. Frequent nighttime urination. Nocturia, the need to urinate multiple times during the night, is another potential early symptom of kidney damage. This condition is often linked to polyuria, the excessive production of urine, which can occur in CKD. Some individuals experience this increase in urination solely at night, while others notice it throughout the day and night. The disruption in the kidney's ability to balance water and salts plays a significant role in nocturia. While nocturia can also be caused by aging, diabetes, urinary tract infections, prostate enlargement, or pregnancy, it's strongly associated with declining kidney function. Studies have shown that individuals with nocturia often have a slightly reduced estimated glomerular filtration rate, eGFR, which measures kidney efficiency. 3. Blood in the urine. The presence of blood in your urine, known as hematuria, is another sign you shouldn't ignore. Hematuria can be grossly visible, gross hematuria, or detectable only under a microscope, microscopic hematuria. In early CKD, both types may occur. If your urine appears red, pink, brown, or tea-colored, it could indicate gross hematuria, which often results from bleeding. Microscopic hematuria, on the other hand, doesn't cause any visible changes in urine color and is typically identified through routine urine tests. Research highlights the importance of this symptom. A study conducted in 2018 found that individuals with moderate CKD who had microscopic hematuria were at a higher risk of disease progression and mortality within the first 2 years of detection. This risk was even more pronounced in individuals with lower eGFR levels. 2. Reduced urine output. A noticeable decrease in urine production, medically referred to as oliguria, can sometimes accompany CKD. While chronic kidney disease itself rarely causes a sharp drop in urine output, other factors, such as acute kidney injury, may trigger this symptom in those with pre-existing CKD. For example, individuals with CKD, due to a urinary outflow obstruction, may experience a sudden decline in urination if the blockage worsens. Severe dehydration, blood loss, or shock can also limit blood flow to the kidneys, leading to reduced urine production. If you find yourself producing significantly less urine than usual, it's a sign that your kidneys might not be functioning properly and warrants immediate medical attention. 1. Persistent flank pain. Flank pain, or pain in the sides of your abdomen between the ribs and hips, is a common symptom among individuals with kidney disease. This discomfort can stem directly from kidney-related issues or from complications associated with CKD. For instance, polycystic kidney disease, PKD, a genetic condition characterized by cysts in the kidneys, often presents with chronic flank pain. Other kidney conditions, such as infections, tumors, or blood vessel abnormalities, can also lead to this symptom. Additionally, blockages in the urinary tract caused by stones or other obstructions increase the risk of CKD and are frequently accompanied by flank pain. If you experience the symptoms we've discussed, What steps can you take to protect your kidneys and halt the progression of chronic kidney disease, CKD? Who's at risk for CKD? The likelihood of developing CKD increases if you have conditions like hypertension, diabetes, cardiovascular disease, or heart failure. Among these, high blood pressure and diabetes are the two leading causes of CKD in U.S. adults. Statistics reveal that 1 in 5 individuals with hypertension and 1 in 3 with diabetes will eventually develop CKD. Environmental factors, as well as living in areas where CKD is widespread, can further increase your risk. Additionally, certain medical conditions, such as recurring kidney stones, urinary tract abnormalities, HIV, lupus, vasculitis, or a family history of kidney disease, also raise the odds. Other contributors include medications, exposure to radiation therapy, and a family history of CKD. Understanding CKD and its progression. CKD is defined by a reduction in kidney function that persists for at least 3 months. As kidney tissue deteriorates over time, it leads to a gradual decline in functionality that often spans years. This decline is classified into 5 stages based on the estimated glomerular filtration rate, eGFR, a key measure of kidney health. CKD is associated with numerous complications, including fluid and toxin buildup, high blood pressure, anemia, imbalances in electrolytes, and weakened bones due to insufficient calcium and vitamin D levels. As CKD progresses to its advanced stages, symptoms become more apparent. These may include fatigue, nausea, poor appetite, metallic taste in the mouth, weight loss, swelling in the legs or around the eyes, shortness of breath, and confusion. The importance of early detection. Early identification of CKD can prevent its progression to severe stages. A recent study showed that patients diagnosed at stage 3 CKD experienced slower kidney function decline when managed early. Unfortunately, CKD often remains undiagnosed until advanced stages because early symptoms are rare. To detect CKD early, regular screenings are crucial for individuals with high-risk conditions, including diabetes, hypertension, or cardiovascular disease. If you have type 1 diabetes, screening should begin 5 years after diagnosis, while for type 2 diabetes, testing should start at the time of diagnosis. Diagnostic tests for CKD. 2 primary types of tests can help in the early detection of CKD. 1. Blood tests. Blood tests evaluate serum creatinine levels, a waste product generated during metabolism. Your eGFR is calculated based on creatinine levels, providing a measure of kidney efficiency. As kidney function declines, eGFR decreases, and creatinine levels rise. Blood urea nitrogen, BUN, tests are another way to assess kidney function, though they are less reliable than serum creatinine. BUN levels can vary due to other factors, such as diet, dehydration, or medical conditions like heart failure and gastrointestinal bleeding. Serum creatinine, by contrast, remains consistent and provides a clearer picture of kidney health. 2. Urine tests. Urine tests check for protein levels, specifically albumin, which should normally remain in the bloodstream. Kidney damage allows albumin to leak into the urine, indicating potential CKD. The urinary albumin to creatinine ratio, ACR, is used to estimate how much protein is being lost in the urine. Other signs of kidney damage may include blood in the urine, abnormal findings from microscopic urine exams, CKD-related imaging or biopsy results, electrolyte imbalances, or a history of kidney transplants. Preventing CKD and avoiding dialysis. The best way to prevent CKD and its complications is through a healthy lifestyle. This includes maintaining a balanced diet, engaging in regular physical activity, avoiding smoking, managing your weight, and limiting alcohol intake. Following up regularly with your healthcare provider for kidney function monitoring is equally essential. In conclusion, CKD is diagnosed when kidney dysfunction persists for 3 months or longer. Early warning signs include foamy urine, blood in the urine, reduced urination, nocturnal urination, and flank pain. CKD is a significant global health issue, increasing the risk of cardiovascular problems. Most cases are diagnosed late due to the asymptomatic nature of early CKD, which underscores the need for regular screenings. Awareness of your risk factors, particularly hypertension, diabetes, and cardiovascular disease, is critical. Educating yourself on the symptoms and taking proactive measures like adopting a healthy lifestyle and scheduling regular screenings, can significantly reduce your risk of developing CKD or delaying its progression to the point of kidney failure. If the information was helpful, then like the video and subscribe the channel for more informative videos.